Thanks again.
Awesome. All right. Thank you very much to Envision, Rob, Caitlin. We're going to move along so that we stay on track. And so next, I'm going to invite Manitoba Possible to present.
Perfect. Thanks, Leanne. Hi, everybody. I'm Mike Bardby, and I'm the Program Development Manager at Manitoba Possible. And I'm just going to get my slides up here. So I'm going to be talking about our online platform for self and family managed care, which is called Care Possible. And, oh, sorry, give me 1 second. Okay. So as I said, I'm talking about Care Possible, which is our online platform for self and family managed care. And I'm going to be starting with a little bit of background on the project, which was actually initiated prior to the ITF. And then I'll talk about the scope of our project. We'll look at some of our deliverables and our plans for the future. So as I mentioned, it's an online platform for self and family managed care. And you might be wondering how it is exactly that we decided to get involved in a technology project in this sector. And it really does go back to our vision and mission. So we believe in an inclusive and accessible society, and we move towards that vision by working together to eliminate barriers to full and equal participation. And for a lot of people, you know, whether they're caregivers looking for a little bit of respite, somebody with a disability who just needs a little bit of help around the house, that self-managed care is a big part of making their world more inclusive and accessible. And when it works, it tends to work really well for a lot of people. But over the years, we kept hearing, you know, some of the same issues over and over again from the people that we serve. So for some people, it can be a real struggle to find a worker. You're managing paperwork, scheduling, making payments, dealing with cancellations. And then having to be out of pocket with payments can be a huge barrier as well. And the net effect of all of this is that that care that's supposed to be providing benefits is actually, you know, a source of stress, or people are just not able to access it whatsoever. So the question that we framed this project around was, how might we make caregiving services available to all Manitobans when and where they need them? And we framed that question around a few key values. So first, we recognize that caregiving is essential work, and there's really significant systemic and individual benefits to those caregiving services. We also recognize that everybody who accesses care deserves to have a really excellent, dignified, and respectful experience. That was something we heard loud and clear from our stakeholders. Receiving care, it's an intimate experience. We felt it was really important to create a system that had a human touch and a sense of community. And lastly, you know, just being an organization that's focused on accessibility, we recognize that care needs to be financially accessible and available when and where it's needed. So this initial idea is what led us to our first pilot project in this space, which is called Envoy. It's you may be familiar with that name. It was a minimally viable product, meaning it was pretty bare bones, but it really helped us understand the wants and needs of people looking for this type of service. And it also demonstrated that, just like we suspected, this was an area that was really ripe for innovation. It was around that time that we applied for funding through the Innovation and Transformation Fund, just to help us realize a fully featured version of our online platform, which was Care Possible. So there were a couple sort of key outputs of our project. First, of course, was launching that fully featured platform. That involved working with a New Zealand-based developer to scope the project, develop the technology, conduct user acceptance testing, and then culminating in a public launch in November 2022. And then the second output was an analytics component. And this was the part that was really enabled by support from the ITF. So analytics was something we really wanted to include because we, you know, as we were researching this project, we started to realize that there wasn't really a centralized source of data related to self and family managed care. So things like how long it typically takes to find a worker, administrative and overhead costs, and average wages for this type of work. And being able to answer those types of questions is really important because it ultimately leads to better policy decisions and more supports for families. So with the support from the Innovation and Transformation Fund, we're able to include that analytics functionality in the scope of our project. And then thinking back to those values, there were some key priorities that we wanted to achieve with this platform. So first and foremost, we wanted to make care less of a headache to manage. We wanted to just make sure that people accessing respite were able to realize the full benefits of that support that they were receiving. We also wanted to make care more affordable. So we recognize that there's a disparity between people who can afford to pay out of pocket to top up a wage, or having to be out of pocket while you're waiting for reimbursement can be a significant barrier for some people. We also wanted to increase the caregiving capacity of local communities. So, we hear constantly about worker shortages, and part of our belief with this project is that more people would be willing to get involved in delivering care in their communities if the barrier to entry was lower. And so we worked to create a platform that would essentially grow the supply of DSPs who might then go on to do more work in this field. And then lastly, through the analytics piece, we wanted to generate new insight into the caregiving services landscape and thus drive more informed policymaking decisions. And so our solution, as I mentioned, was Care Possible, which is our online platform for self and family managed care. And it is essentially, you can think of it as being similar to other workshare type of platforms. So it's like a marketplace for people looking to purchase or provide caregiving services. And it helps self-managers organize and pay for those services. Primarily, though, it really is a response to that key challenge of finding workers. So it's a place where people who are seeking caregiving services can connect with people offering those services near them, knowing that everybody on the platform has been vetted and verified. I'm just going to keep us rolling here. Just a quick note about our cost recovery model. So Manitoba Possible, of course, is a nonprofit, and Care Possible doesn't receive any sort of operational funding from government. So that being the case, we charge a marginal fee to sustain the platform and just continue to be able to offer that service. So currently, clients on the platform pay a 10% fee on services delivered over the platform, and care providers pay a 5% fee. Even with this fee in place, we're really pleased that compared to some of those traditional models, and particularly private care providers, service providers on Care Possible typically receive higher wages on average, and clients pay significantly less in overhead. And this is really apparent when we look at home care, especially. And again, financial accessibility is something that's really important to us. So we're constantly evaluating the service model. And what we'd like to see ideally is that the service fee component is covered by the funder. To us, this is a win-win because it's lower total cost than some of those other models of service. And it takes a huge burden off the shoulders of the care recipient themselves. But we continue to explore those options just to keep those fees as low as possible while keeping the platform sustainable. Okay, and then on to some of the analytics. I'll share some of the outputs that we generated. And again, as more users join the community, the utility of these statistics will just continue to improve over time, which is great. But just at a glance, looking at some data from Respite, we can see that of the 41 listings which mentioned Respite, 12 of those made agreements with care providers during the course of the project. And 8 of those 12 agreements were signed less than 1 month after the listing was published. I think it's also worth mentioning that a lot of the people who tend to come on to Care Possible seeking respite are folks who have really struggled to kind of find a respite provider through some of the other options that are available to them. So those 12 agreements, they represent a real success in terms of matching families with a care provider who's a good fit that they wouldn't have been able to find otherwise. And then I'm just taking a look at some of the demographics of clients who are using the platform. As you can see here, it's predominantly women. It's interesting to note, though, that among clients who are looking for their own care, the split is somewhat even. But then when we look at organizers, that is people who are managing care on somebody else's behalf, the difference is a lot larger. And that's consistent with what we see in research literature as well with regards to family caregivers. And I think that, it's fair to say, when we're talking about providing family caregivers with better tools and supports, it's a gendered issue. And so one of the ways that we can address gender-related disparities is by improving the availability of supports for family caregivers, including through tools like Care Possible. And then I just wanted to share this map of ratio of workers to job listings within Winnipeg. And this is the sort of thing that makes me really excited because this would have been impossible to produce a little over a year ago. So these type of outputs can give us insight into what I like to call care deserts. So basically, where in the city is it going to be the most difficult to find care? Where are the needs the highest relative to the number of workers who are available? So this is an early map, but we can see that, looking at Wolseley and West Broadway, there's kind of a higher number of workers. And then in neighborhoods like River Heights, St. Boniface, the North End, there's more need and less workers available. So we could work to understand, how these ratios affect a person's ability to find care and implementing strategies to improve the availability of care in those areas, like targeted recruitment, that sort of thing, and evaluating the effectiveness of those interventions over time. And that's something that we would hope to eventually implement province-wide. So just a high-level summary of some of the outcomes of the project. Over the course, we managed to register over 1,800 unique users. We had 239 vetted and verified care providers join the platform. 174 jobs were posted. 193 jobs were posted. And over 1,400 hours of service delivered at an average wage of $18.08 per hour. So based on these stats, we're really confident that the need for this type of service is there, and that we're moving in the right direction to bring this to more people province-wide. Of course, with any project, there's going to be some challenges, and the first would be technical issues. Any new technology, there's going to be some hiccups. We've managed to keep the site online 100% of the time, and just kind of doing some ongoing work to keep the user experience as smooth as possible. Also working to continue improving our brand awareness. Of course, trust is really important when it comes to caregiving services. So we're working to just let people know that Care Possible is an option for them, and also that it's an offering of Manitoba Possible and related to our overall brand. And then lastly, some challenges related to partnerships. And I think that this is something that's universal to innovation efforts, certainly within organizations, but especially when you're working to collaborate across sectors. So we're continuing to work with agencies and funders just to make sure that Care Possible integrates with their existing processes, and trying to drive some process change where possible. We've had to look at things like invoicing and payment to make sure that clients are able to get to provide the reporting requirements that they need to get reimbursements. But developing those relationships has been difficult at times, and something that we're going to need to sort of continually work on to make sure that the platform is sustainable. And then lastly, some opportunities for growth, always working to eliminate those out-of-pocket expenses that I mentioned, working with funders maybe to secure direct billing options, or potentially other means such as payment gateways to temporarily float costs while families wait to be reimbursed. Addressing the worker shortages is another big one. We'd love to sort of eliminate the need for social service agencies to rely on temp agencies and provide kind of a more affordable option. We see it as a bridge to more long-term staffing solutions in the field, and serving kind of as an on-ramp to more DSPs. And then lastly, just working to continue generating more data and insights. And as the platform grows, the data that we'll be able to produce will be more and more useful to address issues like wage disparities, care deserts, that sort of thing. It's new data that we've never been able to capture in Manitoba, and we're really excited to see how it can continue to drive policy and advocacy efforts. And that is the end of my slideshow. I would have loved to give you a live demo of the platform, but I see that I'm already quite a bit over time. So maybe I'll just wrap it up there, and I'll put my email address and the site in chat. And if you would like to get a look at the platform, I'd be happy to give you a personalized tour some other time.